Okay, we are connecting with Dr. Bryant. Dr. Bryant is the director of the Counseling Center at John Jay. Hello, Dr. Bryant. How are you?
Hello. Can you hear me?
Absolutely. Can you hear me?
Yes, absolutely.
It is great being on a call with you. I think with everything that's going on in society and the world today, our students need to hear from a professional and how to deal with some of the issues that we may be facing emotionally and mentally.
And physically as
Exactly.
well. Right, the whole gamut. The whole gamut.
Definitely. Definitely. So before we start, make our official start, I want to thank you on behalf of the president of Student Council, which is Moose, our executives, and the entire Student Council team at John Jay.
Thank you. I'm glad to be here. Thanks for the invitation. You're the heart and soul of John Jay. So it's honored to be asked to be invited to this forum.
Thank you. We certainly appreciate it. So what we're going to do is we're going to start out with the basic conversation, really talking about cabin fever, get a little bit into anxiety. And then if you are okay with it, I'd like to open it up and take some questions from the students. Is that okay?
That's fine.
All right, fantastic. So my first question to you is, what is cabin fever and how does that look?
Well, it's interesting. When Mussarat invited me to this gathering, this Instagram chat today, I had to look it up because I've heard of it, but what does the Merriam-Webster dictionary say about it? Basically says it's that we're irritable and discontent, and it can manifest itself in anxiety. That's pretty much what it defines it as. And when we usually think of cabin fever, we usually think of situations that are things like snowstorms or some weather pattern that has interrupted our lives. So we've endured many days of snow days at John Jay, for example.
Right.
There's a beginning and end to that, though. We know that once that snow starts to melt or the sanitation department starts to remove it, the city's going to come back up. Right. This is entirely different because there is a big question mark. There's so much uncertainty right now as to when this will end. Mm-hmm. And to use, cabin fever is the right word to use, the right term to use. But, it's interesting because, there are words like quarantine, right? Isolation, right? Sheltered in. Those are three different things. Now, quarantine is usually meaning that if you're sick and showing some of the symptoms, you should stay in, right? Right. So that's what it refers to. Sheltered in, that is to you're being asked to stay in. You're healthy, you're fine, you don't feel any symptoms, but you're being asked to stay in. Mm-hmm. All right. So that's forced cabin fever. You're being basically forced to stay in. Right? That's being suggested. And then isolation is just, the fact that you may be by yourself, but I can guarantee you that many of our students are not by themselves. They're not isolated. They're with other people. They're keeping a distance, right? Which is another word, social distancing, which applies to a whole different thing. When you go out to public, you're being advised to stay a certain amount of distance from each other. All right? Right? So that's a whole different ballgame. But the bottom line is, your first question had to do with cabin fever. So it basically can in many cases and prolonged cases basically get you irritable and discontent.
Okay, and what does irritability look like in its different forms?
I think we all probably have experienced that. Short fuses, people getting on our nerves, maybe saying something verbally or on the computer that you later regret sending. Also excessive worrying, staying inside your own head, thinking about all kinds of case scenarios, not eating properly, not taking care of yourself, starting to be distracted by other things. that are going on.
Okay. And so how does cabin fever, how is it different during a pandemic crisis compared to a snowfall cabin fever?
Well, like I said earlier, it's because it's uncertain. There's no, right now, experts are not giving us a definitive time frame. It's unending at this point. It's open-ended, I should say. It's open-ended at this point. And even in some cases, when you have a snowfall for you, you can leave your house. You can go, so you can venture out. Some people just put on some heavy boots and weather gear, and they manage to go out. They are in control. We're not in control. And that is a big factor here. We're not in control of our own debt, which makes it hard for us because we're being told by experts to stay in the house, right? So if we venture out, we're taking greater risks than if it was just snow we had to worry about out there.
Right. So how can we combat, what are some examples of how to deal with cabin fever while in the midst of it?
Well, and deference to all of you, I like to maybe shift the term from cabin fever to just quarantine, sheltering in, because that's what it is, right? We're sheltering in right now. All right. So, because like I said, cabin fever, you have some control over some. Right. This is sheltering in. We're being told to stay in our houses.
Right.
Okay. That makes it different. So that's a term I'm kind of holding on to because we've always, in the past we've used that cabin fever and, you can come out of there. This is now sort of where some of us are on lockdown. I mean, if you really want to use the term, we're on lockdown. So what are some things that one can do? One thing is stay connected. Just because we're isolated doesn't mean that we can't stay socially connected to one another. This is the perfect example, right? This forum connecting, I don't know how many folks are on this, but this is something for people to do and to maybe distract them, get an opportunity to ask some questions, see some faces they haven't seen for a while.
So Dr. Bryant, are you saying that having our classes on Zoom can also help combat
yes.
Us being sheltered in?
Yes, absolutely. Absolutely. In fact, I would even say that, what's wrong with scheduling Zoom sessions with each other? Saying at this time tomorrow, let's all collectively get together and have a date.
We could do Zoom karaoke.
Right. There are celebrities who are having Zoom parties, I'm hearing. Right? Inviting people to them. Absolutely. So, these are the meetings that we have at our disposal. And even, I'll even tell you, in the therapy world, in psychology, the whole landscape has changed in the matter of a week, where a lot of clinicians were hesitant to engage in teletherapy or telemedicine, telehealth, whatever you want to call it. Mm-hmm. Now they're like, no, we forget all the rules. We can still maintain confidentiality, but you can use the telephone. You can use FaceTime. You can use Zoom, right? Because people need, at this time, more than any time, they need to be connected to each other.
Okay. The students, they like to hear the Zoom karaoke. Some of the comments are saying,
okay, good
party.
But, yeah, this is an opportunity. Crisis brings about an opportunity. Right. And, you have to stay positive. I'm sure a lot of questions are going to come forward. Staying positive, reading some stories of people who are overcoming their struggles, thinking about being grateful for what you have right now. I'm sure there will be a lot of questions that are make questions about, classes right now. Yeah, it's a stressful time, but it's a stressful time for everybody, even the professors. They're struggling, for some of them, with technology for the first time that they haven't been familiar with. And it's a rocky road for everybody. All right. Even the stops and starts that have just happened. Right. That's another, situation that we're having to deal with on all ends.
Definitely. definitely. So how does cabin fever and anxiety relate or coexist? And I apologize, I want to use the term that.
No, that's fine. That's okay.
How does being sheltered in
right.
and anxiety coexist? Because a lot of students, a lot of people in general are really suffering from anxiety right now who may have not had symptoms of anxiety before.
Right.
So
well, I had asked, my counselors are all, I'm sorry.
I apologize. So what does anxiety look like? Excuse me.
Well, I mean, it can be just simply nervousness, feeling anxious all the time. I mean, these are all words for anxiety, really. Having panic attacks in the most extreme circumstances where people may literally feel like they're going to faint. Being irritable, as I mentioned before, being caustic to other people.
Okay.
Just obsessing about maybe the worst case, catastrophic, making things into a catastrophe right now.
Okay.
Anxiety is a lot of times what we do, and I'll talk more about this in the media, is that sometimes, anxiety is basically fear, right? It's the basis of that is fear. And it's when things like future events appear real or false evidence appearing real. That's what fear is about. But it's in your mind that it's happening. That's why you need to stay grounded.
And so how do you stay grounded? What are some examples of how we can kind of maintain ourselves and stay grounded?
I mentioned one earlier, and that's staying connected. And I talk about really that being meaningful. The professionals call it meaningful engagement. That's the term that's being used. Meditation.
Okay.
And there are lots of apps. There are rooms, the chat rooms that I understand that are going on. A lot of programs like 12-step programs are meeting, and so there are ways to get, and you can just, meditation doesn't cost anything. You can just find a spot in your room, in your house, in your apartment, and just take some time to just have total silence. And go to, you can go to the web and look up breathing techniques and do that along with the meditation. I think it's good that people can start maybe every day with maybe 5-10 minutes of that, or during the middle of the day. Movement, doing some type of physical activity, even in your house, and talking to people who've done yoga. You can do yoga in your house and with your mat. Do exercise the old-fashioned way, the squat thrust, the push-ups. Doing something, just moving. That's some of the things that you can do. I think there was one other, and I'll come back in a second. But those were at least some of the things you can do to start to combat the anxiety.
Okay. A lot of people worry that anxiety is not normal. Is it normal?
Oh, at this time, especially. Let me just go further than that. Any emotion that you're feeling right now, you're feeling sad, you're feeling frightful, scared, depressed, tired. Running the gamut of emotions right now, in these abnormal times, everything is normal. You are in no more distress or less distress than other people. And that includes adults, professors, businessmen. Everyone is affected by this. Everyone is feeling it.
We appreciate you definitely saying that is normal, right? Because a lot of times we have these emotions that we don't experience on a regular basis, especially now. And we feel like, oh, this is not normal. This is not normal. And because we have these emotions, we kind of panic, and that creates anxiety as well, doesn't it?
Right. We panic about the panic.
Right.
We're like, wait, we're anxious, and I'm not supposed to be anxious. They go, what will happen if somebody finds out I'm anxious? You start going down that rabbit hole. Well, I'll share, for myself. I keep busy. I try to keep busy, but there are moments if there's downtime, my brain may start going down a road, and I have to stop myself and say, let's, ground myself. Let me do something, either start breathing, talking to somebody, picking up the phone and speaking to someone to bring you back into reality. But yeah, people should feel that this is not a time to feel stigmatized, that these are normal emotions that people go through at this time, some greater than others, for sure.
Okay. And so when our students email yourself or the counseling center during this time, is it made clear that these are normal feelings and we should all be feeling this type of thing right now during this time?
Yeah, I talked to my staff. I had a meeting with them yesterday, and I talked to my associate director every day, who's really heading the operation. In fact, just before this thing went live, I wanted to just get updated on what some of the issues are that the students are particularly dealing with. But to answer your question, yes, absolutely. They're not being made to feel ashamed or embarrassed by. This is not a time to, have false pride. This is a time where you take ownership of how you're feeling, and we're giving validation to that. We all need to practice things like empathy and compassion right now. That's what all of us need to do to each other, to be compassionate.
One of the students just said that they've been feeling fear ever since the cases in New York has increased. How do we deal with that, right? Because it's a legitimate fear, right? But we know that New York is 8 million people strong, and we know that the numbers in New York is going to inherently increase because we're a dense city. And it's close together, but hearing the numbers increase on a daily basis is really frightening.
Absolutely, and it speaks to a couple of things. Well, you point to the fact this is real, so we can't. Denial is not good for us either. Although it can be helpful once in a while, but it is a real situation. One of the things I would caution people, though, is to stay on the news and watch it obsessively. Do not watch the news obsessively. Do not stay on social media. Maybe, jump in and jump out. There's, on your emails, we're getting lots of information. Read what the experts are saying, right? The cases are increasing, greatly in New York, but you just hit on we're a big city. We're, 8, 9, 10 million people. I'm not belittling the fact that these numbers are rising. They certainly raise concern, but proportionally, there are other places that are raising just as great as we are, right? Other places, and there are other cities that are still kind of in denial that this is even going on. So my advice to that person who asked the question is, accept it on some level, but also don't stare at it. Don't start going through all of media and looking at news reports and and listen to what the experts do to take caution in what you can do to protect yourself. Okay. So, and can I say one other thing just on that matter? Is that, if you do read the experts, and a lot of people are saying that you hear varying stories there is a greater number of people who have it, but because the inaccessibility to testing kits, we don't really know how many people truly have it. The experts are saying to everyone right now, this is from the governor's office, presume that you have the virus. Presume that you have it, and take every necessary precaution to protect yourself and others. Okay? So, and we also know that not everybody this is not fatal for everybody. That there have been people who've contracted it and have had flu-like symptoms and dealt with this for 2-week periods, and then have gotten better. And that has been happening across the world.
So are you saying it's better for our mental health to pay attention to the facts? Yes. And that would help alleviate some of the fear of what's going on?
Right. Get the facts, number one. All right, get the facts, because if you don't have information, it makes you more anxious.
Right.
And two, get credible facts.
Right.
Things that are being released by New York State Department of Health or the City Department of Health. Okay. Those are the places to go through for, and I'm not attached to them in any shape or form, but that's where my sources of information come from, because those are facts, and it doesn't come with all the bells and whistles that you see on the TV.
Okay. And so at this time, I would like to open up the forum to all questions that the students may have. I'll start off with a question from a student. And so the question is, how can we adjust to completing our work in our comfort zone? That has been a huge challenge for, I think, all of us, even professors, faculty, and staff.
Yeah, well, you know, the first thing I have to say, I do teach a course at John Jay.
Okay.
And you know, I've been teaching at John Jay much longer. I've been director of counseling, so you know, I can understand everyone's pain in this area. What I can say is that, first of all, the first goal is to get to the finish line. Look at the big picture. Just let's get through this semester. You know, and I'm hoping that other faculty, and I know other faculty, are being compassionate and understanding, and you know, be easy on yourself as well. You know, when we're in college, we're here for a reason, because a lot of us are perfectionists. You know, we got here because we were hardworking, we're focused, we're determined. We don't want to let ourselves down.
Right.
Be easy on ourselves right now. You know, when you say comfort zone, I get that. You know, that comfort zone rug has been taken from under us at this point. And this is the new normal. Accepting that this is the new normal right now. And it's going to take some adjustment for all of us. But we humans are pretty good at adjusting to things. Okay, our ancestors adjusted to many things, had to deal with a lot of things that were out of their control, and we're here because of them, and because of but what they did to get us to this point.
Right. Okay. The next question I have is, how can we deal with stress, especially being now that we can't really go outside? I think a part of that question is, we can go for a run, we can go walk a dog, right? But we can't like go and hang out. So how do we deal with that stress and not have an outlet to release it in, kind of, sort of?
Yeah, well, we talked about it earlier. You know, go to the new normal. Create a Zoom room for yourselves. You know, meeting place where you can hang out together. I know physical contact and all that is, you know, right now not an option, and that's certainly a stressor right there. But still, the human connection with people, even over the phone, can be ways in which you can sort of help maintain stress. You know, if that's where the question is leading to, really, and that's what it sounds like, it's more because of social. Just the inability to socialize with other people. Right. Find other ways to do it in healthy ways, not necessarily through, like I said, social media and memes and stuff. Real meaningful engagement, talking to people face to face like this, or on the phone. Okay.
And are these emotions that we experience in anger, sadness, frustration, stress, anxiety, we know that you stated that they are normal, but what about those of us who just can't get past those emotions, that, you know, they're overtaking us? What is the next step? What do we do?
Reach out to professionals. Reach out. We have a counseling center, but I'll also tell you that, you know, New York, the NYC Well. That's all you need to know. You can Google that, and they have texting, chat boxes, they have phone, they have email, they have a website you can go to with strategies to help you cope. They have a nice little 2-page handout that I printed out earlier. Just give it the title is Coping with Stress and Social Distancing During the Coronavirus Outbreak. It's right on the web, and there are 2 pages of information that some of which I just shared with you. Go to those sources. Look to see. They give you ideas and things like what to expect. Okay, staying informed, talking about limiting your screen time, keeping connected, reaching out. I mean, these things I just maintaining your daily routines. I haven't talked about that, but that's an important thing too. One of the things that gets disrupted during this time is your eating and sleeping, which are directly tied to anxiety and depression.
Right.
If you're not sleeping enough or sleeping too much or eating too little or too much, that's also a physical sign. You ask, what are some of the signs of anxiety? Well, it's another sign of anxiety, right, that manifests itself.
Right.
So try to stick to a routine in this time. You know, school brought us, and that's one thing that classrooms, the online, the distance learning is helping, because it's giving us some semblance of structure during the day, and that's important. So, you know, you try to get up at your normal time during this time frame. You know, don't sleep in late. Get up at your normal time. Have routine. Like I say, just say, maybe you have a meeting to go to in the morning, a Zoom meeting, or make a phone call or something. And throughout your day, plan out your day. Very important to do. Okay.
So I know I'm experiencing this right now. How do you maintain your mental health while being at home with other family members? A lot of students, right? We kind of get a break from our family by being at school and on campus, right?
Yes. It's an oasis.
And we don't have that outlet now. How do we maintain our mental health in an environment where we don't necessarily want to be? The environment may be stressful, but we have to be there because of the current situation. How do you talk to those students? What advice do you have for them?
Well, let me turn it back to you. What have you been doing that's been helpful?
I've been stressing. I think the best thing that I've done was to say, hey, between 9 a.m. and 1 p.m., don't bother me, to kind of set boundaries. But I'm in a Hispanic and a Black household, so that don't quite work.
Mm-hmm. Right. But
They're
you try.
Call you when they want to call you. They're gonna do
right. But you try. But
exactly.
You've at least attempted to do that.
Right.
Yeah.
But it's stressful though. It's stressful because, you know, and especially for first generation students, their parents don't understand that the college workload is already heavy while you're in a classroom, and then to abruptly shift everything online, it's even more stressful. So the student now is dealing with the stressful household environment that they're in, dealing with the stress of not being able to escape that environment by going to classes, and having to deal with the workload being online, to which is a new thing anyway, right?
Right. Yeah, there's no easy answers and no quick fixes to this issue right now. What you've done and try to set boundaries is an excellent technique. You can just try to do that. One other maybe solution, I know that the meeting classes you can't control, but if there's a certain time where you know, and I don't know if this is the case in your household, where you know everybody sort of sleeps, right, to a certain period, get up earlier than everybody else. Get up earlier than everybody else, and use that time as your isolation time. Because that's what I talked about earlier. This is not really isolation for many students of color. They are in households with other people. Isolation is when you're in a place by yourself.
Right.
We are not in a place by ourselves. We have other people around us. It's how to deal with other people around us during this time of basically sheltering in. So, you know, strategizing. You know, certain people just get up at 8 o'clock in the morning or 9 o'clock. Well, get up at 6.
Okay.
Get the house to yourself at that time. Do your work. Start early. Start early before everybody else.
So,
or one other thing, like you mentioned, if you can, and if you feel like if you need to, you can do a walk, and you can walk in your hallway, or, you know, just get out of the apartment for a little bit. Do that.
Okay. So a lot of students, we stay up late, right?
Okay.
After everyone goes to sleep.
Okay.
11, 12, 1, 2, 3, 4. 5.
I know. I get those emails.
You've seen those emails at 5 o'clock in the morning.
Yes.
So because we're trying to have alone time or time to study or just time to be with ourselves,
right.
Does that affect our mental health by changing our sleep cycle like that, or not necessarily?
No, as long as you're getting some sleep and eating, even if you're shifting. And I said build a routine, just keep it consistent is what I'm saying. All right. So if you decide to stay up later now they run into the risk though, right? Because some of your classes may be morning classes or afternoon classes. You know, I would try to tailor your schedule around what is doable for yourself. But shifting your sleep cycle, because now you want to stay up, which is an excellent idea, is stay up later so that everybody else has gone to bed. As long as you're getting some sleep, and maybe you're going to take naps during the day, right? To catch up on your sleep. But get rest, eat. You know, try to eat healthy stuff. This is not a time to put yourself on some, you know, fad diet. You know, and restrict yourself, and you know, right now you have too many other sacrifices to do. Try to eat healthy, and because that's one of the things I'm hearing from a lot of adults. They're not eating healthy. They're eating lots of chocolate and, you know, comfort sort of sweets and things like that. So just keep a monitor on that.
Okay. Okay. I have a question from a student. They asked, how are the counseling sessions like virtually?
I mean, how are they conducted, or
virtually? Yes.
Virtual. Okay. They're really done. Most of them are done over the phone. Although all of the, I don't know if everybody knows this, but all the staff and faculty at John Jay has been giving access to Zoom. So, you know, because if you sign up for Zoom or you get it just I guess as a trial offer, you only have allowed 40-minute sessions.
Right.
We have unlimited access to Zoom. Right. So it's up to the student and counselor to make that decision, whether they want to have a video platform or a phone platform. Some folks don't want the video platform for the reason you spoke earlier. There are a lot of family members in the house, and it's difficult to maintain privacy and confidentiality with a video. Same thing that I'm hearing with the classrooms as well. That's some of the feedback I'm getting is, you know, first of all, some students have to share computers with other family members who are also, like if you have kids who are brothers or sisters who are in the public schools, they're doing all their stuff virtually too. So the balance, you know, between who uses the computer when, that's another stressor that is also compounding things here.
Okay.
Because I don't know if that answers the question for that question that was asked, but it's if they're asking the format, it's done either way, but it's a decision made between the counselor and the student.
Fantastic. That's great. That's great. Are there any other questions from students for Dr. Bryant? Just type them in, and he'll be more than happy to answer those questions that you all may have.
I saw some comments like most of my quarantine food are snacks.
Sure.
Yeah. Yeah. Well, you know, when you make that grocery run or somebody try to pick up some healthy snacks in there.
We're gonna come out of this with a pound or two extra.
Yeah.
So it doesn't look like we have much questions. So what I would like to do is see if we can, before we summarize some of the techniques that you gave, could you talk a little bit about normalizing mental health, right? There's this huge stigma, especially amongst minority students, about seeking help, about talking to a therapist, a counselor, and in general, just want to have a conversation with someone. Can you talk about how we can help normalize seeking help when we need it, and that is actually it's a normal thing to want to speak to someone. It's normal to have to sit and get some things off your chest.
Yeah.
And also I think too, for me, counseling or seeing a therapist is not about having a mental health issue. It's really about having the opportunity to sit on the other side of a table and just having someone to listen.
Right. Exactly.
What are your thoughts on that, and how can we best normalize mental health?
Yeah, I think all too often in our communities, we associate going to counseling or therapy as having some kind of mental illness. When indeed it's just exactly what you mentioned. So you have some issue, you have a relationship problem, you have an issue with family members, right? Something that we all have. You have an issue with school, you have an issue with work, right? Everybody has these issues.
Right.
Just because you go to a therapist does not mean that you're crazy.
Right.
Okay. It's that is, and it's unfortunate because in our communities that stigma is still there. Although I will say that I think it's been breaking down as of late, because many celebrities and sports figures have talked at length about the fact that they're in treatment and getting therapy and going to counseling. And if you have any doubt, just Google it. Just see, some of your folks that have been, out there who are actually promoting this, as something to do is for health, for your mental health and your physical health as well. If you have as I tell people, if you had a broken arm, right? You broke your hand, you broke your foot, you go to a doctor. Well, right now we have a lot of pain and suffering that's going on out there. So it's okay to go to speak to somebody about it, even to vent for a few minutes. Someone who's objective and is going to listen and is not going to overwhelm you with advice and things like that, which maybe a family member or a friend might do or might be judgmental. You need people who are non-judgmental right now.
Okay. And that's the benefit of seeing a therapist.
Yes.
In a non-judgmental seat and
absolutely.
Right.
And then the important thing is to also find the right fit for you. There's sometimes you go to a therapist, you just don't feel a connection. That's okay too. You have to feel comfortable in that setting. This is a very important relationship that you're going to have with somebody. So if you don't feel initially comfortable with someone, it's okay to, maybe see someone else. And I will just say this, if, folks are, besides NYC Well, which is a great free service, if you have insurance right now, you can go to Psychology Today. A lot of therapists, everybody who's on that website it's basically, a website that people advertise. They have sent everybody special instructions to indicate what type of services they're providing during this time. So whether it's, they're available for telehealth sessions, because therapists have been recommended not to see anybody in person.
Right.
And insurance companies are reimbursing for telehealth services right now. Okay. Just so people know that.
Thank you for that.
Let me come back to, did you have another question?
No, go ahead and we can get to the student questions after you're done. No problem.
Okay, one other thing that I ticked off a bunch of things before. I talked about meditation. I talked about meaningful engagement. I talked about movement. One other M is mastery. You at this time you can want to pursue some habits, some hobbies that you may have, some skills that you might like. There are a lot of museums and things like that doing virtual tours, parks, things like that. Escaping. It's all about escaping, right? And sometimes going to other places. If you like to cook, why not learn how to, you don't cook, learn how to cook, learn how to bake. I know, sometimes getting your hands on the ingredients might be more difficult, but still there are things that you can do to learn a new game like chess. some of you, now this is for the older generation, you know, if you're not tech savvy, this is the time to learn about technology, right? This is the time to instruct yourself on how to use all of these tools that are necessary in the 21st century.
Exactly, exactly. Another question from a student is, any advice on how to deal with burnout and the unrealistic expectations of professors? Let's stick with the burnout.
Those are two, yeah, two distinct. So I can give you some examples. So, you know, in a day where I'm spending most of the day, like yesterday, I spent a lot of time on Zoom teleconferences. I'm very cautious. First of all, don't spend a lot of time on, you know, try to minimize your time on screen time. That's one of the things I'm cautious of. But I sort of, at some point during the day, I say, usually around 6 o'clock, okay, I'm going to turn off work and I'm going to just take an hour or half an hour for myself and read something, or even maybe take a nap, whatever I choose to do, reboot myself, and then take care of social things, make some phone calls to people, right? I've made a list of people to reach out to during this time. So kind of dividing your day so you don't feel like you're working 24/7. Because it's very, even for those who are telecommuting, it's very easy to work 24/7. Thinking you have to answer that email at 2 o'clock in the morning. No, you don't. Set up a time that you're going to work, okay? And do your schoolwork. If you are fortunate to have a job that you're telecommuting, and maybe even go to, because some of our students are considered essential, and we do have some students who are still working. You know, just break up your day and structure it so you don't feel like you're in school 24/7. There was a second part to that question. It was just, how do you deal with the expectations, I guess, of professors who may be too demanding during this time? Well, you know, the first thing I say is that, you know, have a conversation with the professor if you feel comfortable enough to do that. If you need to run it up the chain, you can call one of my counselors or email us, and we have been instructing students to get in contact with the chairperson, department chairperson, to speak to them, okay, so that they're made aware of what is going on. I want to just tell you, from the president on down, I mean, the message is clear, and, you know, not that everybody's following it, but, you know, right now is the time not to be piling on work on our students. Be respectful of the boundaries that we have set forth. For example, starting tomorrow, for those that are not on the original online classes, right? Those are shifted to distance learning. Starting tomorrow till through April 1st, we are on another recess. Right. Professors should not be, according to the chancellor email, assigning work during this period of time.
Right.
Okay. Now, does that happen? I'm sure it does. But that's a time to have a discussion with that professor, or if they're not listening, talk to the chairperson. And but I would suggest calling counseling, because that's one of the issues. That's actually, like, next to the top of issues that students are calling about is sort of the new normal, dealing with this situation, this change in the landscape, and two, the academic challenges that have been presented because of this. That's right at the top of what my counselors are getting.
Yeah, definitely, because that plays right into the anxiety, the stress, the frustration, and the burnout as well.
Right. And that's why I say that, because if you think you're out there and you know it's only me this is happening to, I'm trying to normalize this for everybody. No, you're not alone. This is what we're hearing over and over again, is the academic demands, the shifting of the classes. When are we meeting? When are we not meeting? You know, that kind of thing.
Okay. Well, if there aren't any, I'm sorry, there is another question. Someone asked a question: what should students do if a professor assigns work, exams, etc. during the recalibration period? I think if you email us, if you DM JJC Council, we will be able to answer that question for you. I just want to make sure I respect Dr. Bryant's time as a counselor and deal with mental health issues at this time, if that's okay with everyone. Dr. Bryant,
can I just add on to one other thing that you just said there?
Absolutely, please.
This is great. Is go to John Jay's website. Click on the coronavirus tab on the top. It'll bring you to a link with all the most updated academic information, with names and people to get a hold of. But I think it's an excellent idea. Speak to your student council representatives. They are in the know. They are connected to the faculty, to the provost, the academic deans. They are the ones who can help you during this time.
And again, if you have any questions or concerns about the recalibration period, as Dr. Bryant said, you can definitely go to John Jay website and click on COVID-19, or for much easier or better clarification, you could DM student council, and we will be more than happy to answer any and all of your questions. We are absolutely here to serve you and to answer any questions you have during this time. Please don't forget that no question is a stupid question. So any question or clarification that you may have as a student, we're definitely here to answer those questions. Dr. Bryant, thank you so much for taking out time of your schedule to have this conversation with us, to discuss the importance of mental health and how to deal with anxiety during this time. On behalf of our president, once again, Moose, our executives, and the entire student council at John Jay, thank you for your time. We certainly appreciate it.
Thank you so much.
Have a great night.
You too. And please, everyone, be safe, stay well. And just, can I end on one note? And just
Absolutely, please.
Yeah. Be kind to your family. Be kind to your friends. Be kind to others. Be kind to strangers. And be kind to yourself right now.
Thank you.
Okay.
Have a great day.
Have a good night. Take care.
Thank you all. Stay tuned.